Hi, Dr. Heather here, and today I'm going to talk about shoulder pain. I want to share with you a powerful, low-risk, non-surgical, new way to help relieve shoulder pain. But first, let me ask you a question. Do you or someone you love suffer from shoulder pain? Does shoulder pain prevent you from doing the things you love or from getting a good night's sleep? Have you been told the only thing that will help you is surgery? Or have you already had surgery on your shoulder but it still hurts? Do you wish you could try a non-surgical procedure to get pain relief? What if there was a way to have significant shoulder pain relief that lasted a year or more without the harmful effects of steroids or the risks and months of recovery time with surgery? Wouldn't that be amazing? To get shoulder pain relief and be able to return to an active lifestyle, many people think they need to get steroid shots every 3 months, which have a lot of negative effects for both the shoulder itself and the whole body. Many people also think or have been told the only other option is surgery. Or if they've already had a surgery on their shoulder, that they need to have another surgery or get the joint replaced. But there is another option. I've shared my own cellular shoulder success story with many of you in person and in a different video. But today, I'm going to share my patient Doug's story. So Doug came to me with this significant right shoulder pain and weakness that had been going on for at least 6 months. He initially went to an orthopedic surgeon who did a steroid injection in the shoulder, which didn't really help his pain. He also went to PT, which was painful for him, and he didn't really feel a benefit. He was taking Advil and Tylenol daily to help his pain. He was not able to sleep because the pain seemed to get worse at night. In the last 3 months, he could feel his right arm getting weak and could not lift it over his head without severe pain. He went back to the orthopedic surgeon who offered him surgery, but that was going to be a 3-month recovery. So he came to me to explore his regenerative options. To be honest, he was not very optimistic that I could help him. I examined him in the clinic, and his right arm was very weak, and the shoulder was painful when he tried to lift the arm or internally rotate it. So I did some specific physical exam maneuvers, and my suspicion was that he had a rotator cuff tear. So I ordered an MRI, and sure enough, he had a fairly large tear in the supraspinatus tendon, which is one of the tendons that make up the cuff, and the most common one injured, that went through 75% of the tendon. He also had a large effusion, which is lots of extra inflammatory fluid in the joint, and a spur that was narrowing the outlet of his rotator cuff. So I chose a treatment plan that included an autologous cellular procedure, also K-laser treatments, and 6 Emsculpt sessions to make the deltoid, bicep, and tricep much stronger to better protect his shoulder in the future. I also put him on some of my favorite peptides, BPC 157, thymosin alpha-1, and thymosin beta-4, to help the regenerative and healing processes, not just in the tissues, but in the cells and even on the genetic level. So what is autologous cellular therapy? Well, by definition, autologous cells are stem cells obtained from one's own body. Of all stem cell therapy types, autologous harvesting involves the least risk. What are stem cells? So stem cells are cells that can differentiate into other types of cells, meaning they can change from being a stem cell into being a muscle cell or a tendon cell or a bone cell. They can also divide in self-renewal to produce more of the same type of stem cells. So in regenerative medicine, we only work with adult stem cells, which are found in various tissues of fully developed humans. In adult organisms, stem cells and progenitor cells, which are like stem cells but lying dormant in all of our tissues, act as a repair system for the body, replenishing adult tissues. Stem cells can differentiate into all the specialized cells, ectoderm, endoderm, and mesoderm, which then go on to become all of our tissues, but also maintain the normal turnover of regenerative organs, such as blood, skin, or intestinal tissues. The 3 sources of autologous adult stem cells in regenerative medicine are bone marrow, adipose or fat tissue, and blood. But only a very few of us know how to isolate the cells from the blood. Of all stem cell therapy types, autologous harvesting involves the least risk. By definition, autologous cells are obtained from one's own body, just as one may bank his or her own blood for elective surgical procedures. Now let me show you in a little more detail the structures that can be treated with cellular therapy and that were treated for Doug. I'm going to come over here and show you my little anatomy program. I love this program. So this is the shoulder, this is the big trapezius, this is the deltoid muscle, and we're going to go a little deeper underneath here. These are the deeper muscles underneath. This is the supraspinatus, and this is the supraspinatus tendon. See how it comes in and attaches here? And I'm going to show you, I'm going to rotate this around so I can show you, look how important, let me see, let me flip it here. Make it a little smaller so you can see. All of these structures over here, all these ligaments. So this is the clavicle, and you have the acromioclavicular joint, and underneath here is where that spur, and this is very common for a spur to develop here, or enlarged bone, and that's what impinges on the outlet of the rotator cuff. So it starts to touch or put pressure and narrow where these tendons can come out in here. See, go down one level. That's taking muscles away from more than just the shoulder. So here you see the capsule and the joint itself. It's really not much of a joint. It's more like a golf ball on a tee. It's really held together and stays functional through all these soft tissues, connective tissues, and not as much bone. I'm going to put the muscle back on so you can see the rotator. So these are all structures that get treated. The capsule itself, inside the glenohumeral joint, inside the AC joint, all of the ligaments in here, and under ultrasound, we go in and treat the tendons as they attach, especially where the tear is, and start to shore up this shoulder and make it stronger. And this was where Doug's tear was in his supraspinatus tendon. So how did Doug do? Well, now he has no pain in his right shoulder and has recovered all of the strength in his arm since the procedure. He's been able to play tennis without pain, even an overhead serve, and is thrilled with his result. The extra strengthening of the muscles from the Emsculpt has really helped him stay strong and protect the shoulder from another injury. He had a difficult first week after the procedure, but the peptides and the K-laser did help his pain and sped up the recovery time. He is now 3 years out from his procedure and doing great. So in summary, we talked about regenerative options for shoulder pain. I shared with you one of my patient's stories, Doug's story, how he was offered surgery, didn't want to have surgery. He had a regenerative procedure even for a tear and had a fantastic outcome. And we discussed what is autologous cellular therapy. So for more information about regenerative procedures for the shoulder pain, please go to drheather.net/shoulder pain. That's drheather.net/shoulder pain. I'm so glad you joined. Thanks for listening. We just want to help you live your best life ever.